Now, to learn more about the Kettle Creek battlefield, go to this story on Wjbf.com. In Columbia County, the school board has delayed a vote on the new school superintendent. No reason for the delay has been given. The three finalists are Gwinnett County Associate Superintendent Dr. Stephen Flint, Columbia County Associate Superintendent Penny Jackson, and Columbia County Assistant Superintendent Michelle Sherman. Current Superintendent Dr. Sandra Caraway is retiring at the end of this school year.
I think our biggest focus is to make sure we pick the right person to lead us to the next level and to continue our culture of excellence.
And we'll continue to follow the superintendent search closely in the coming weeks. Well, this morning, Columbia County School District is mourning the loss of one of their own. Jennifer Watkins passed away Monday after she got the coronavirus. She was an instructional specialist at South Columbia Elementary School. Funeral arrangements are still being finalized. Beginning next week, students in Edgefield County will return to the hybrid model. The board announced that the decision late last night. Initially, the board had moved to learn fully virtual last week after a spike in cases of COVID-19. They now say most of the cases can be traced to places other than schools. Fully virtual learning is still an option for students who prefer not to learn in person. It's 5:06. Time employment has been a very big problem during this pandemic, but there's one industry working to hire people fast. Companies that run home care and hospice facilities are struggling to get folks hired. It's simply that more people are choosing to receive care from their home rather than at a facility full of people. It's a problem that News Channel 6's Berkeley Bishop learned is going to get worse before it gets better.
We're looking at an estimated 40,000 new patients coming into home care on a monthly basis who are infected with COVID. And then we have 12 million people receiving care otherwise. So this is a very huge undertaking to deliver all these services with it.
Now, to learn more about how to find a job in the home care industry, go to this story on Wjbf.com. In South Carolina, the Department of Health and Environmental Control is announcing a change in the way it plans to allocate vaccine doses. And Maxwell reports.
Right now, vaccine doses are allocated to different providers. Now, DHEC wants to allocate doses to counties based on population size. At a live-streamed meeting, DHEC board members voted 6-2 on a new plan to allocate vaccine doses to counties based on size.
All those in favor?
According to DHEC's interim public health director, Dr. Brandon Traxler, they need a new plan on who gets doses because there aren't enough to go around right now. She says allocating doses will allow providers to plan ahead.
So whatever gets it out the fastest, to me, we just got to follow that path.
Dr. Traxler presented two possible paths for distribution. Model A, in which a county's allocated doses depend on population, and Model B, in which allocations mostly rely on population but also consider counties' vulnerable and aging populations. The board voted in favor of Model A, but their decision will allow health officials to work with providers on implementing it over the next 2.5 weeks. That's when the board meets again.
We don't want to slow down the efficiency of these large providers. And so it will give us time to work with those large providers to ensure that they can serve those areas, if possible, with their machine, so to speak.
Under Model A, Greenville County, the state's largest, would receive nearly 5,800 doses a week. This week, Greenville County-based providers are receiving nearly 16,000 doses, but they may be distributed elsewhere. Board members spoke about the need to make sure rural communities aren't left behind.
With this motion, it's going to allow staff 2 weeks to address those concerns that we've got, for me, more specifically, concerns within rural communities. Is that correct? Yes.
Until DHEC's next board meeting in 2.5 weeks, the current system for allocation will continue. That's according to Dr. Traxler.
Well, Georgia health officials report a downward trend in the number of hospitalizations. That's good news. The percent positive has dropped to nearly 15%. That's the lowest since January the 1st. Now, the state is currently receiving 120,000 doses per week from the government.
Our goal continues to be twofold. One, to utilize our current allotment as quickly and safely as possible. Two, plan for the increased supply whenever that day may come. Dr. Toomey and our entire team continue to explore ways that we can maximize our efforts to quickly put more shots in arms.
And more good news, the federal government announced yesterday that Georgia will begin receiving 25,000 more COVID vaccine doses each week. Doctors at AU say even